My name is Michael Ruttenberg, and I am the clinical director at Larimer County's Criminal Justice Services. Criminal Justice Services is a division within Larimer County government that oversees both the Alternative Sentencing Department and the Community Corrections Department. We are an alternative sentencing area of criminal justice, meaning that we provide alternatives to traditional jail or prison settings to allow people to serve their sentence for the crimes that they've committed. Our intention is to intervene in the underlying factors that contributed to their getting into trouble in the first place. Our hope is that we reduce their risk to recidivate and have folks continue to contribute in a healthy way to our communities. My why. I got into behavioral health services because I had a desire to help adolescents and their families that were struggling with behavioral health issues. I did that work for approximately 12 years in residential settings, providing treatment, substance abuse treatment, behavioral interventions, as well as family therapy to those individuals on behalf of the courts and the child protective systems. I found that we did really important work in those settings. We allowed those adolescents and those families to have their children back for a period of time. However, they returned back to those environments. And without truly intervening in those home environments, it was very difficult to create lasting change. I believe that we planted lots of seeds. I believe that we changed the trajectory of a lot of people's lives. That brought me to the adult system, taking a different approach on the same work. I came to Larimer County to start a really creative, innovative community collaborative program that is now known as the AIM program. It was designed to serve those with significant and persistent mental illness that found themselves engaged in the criminal justice system. Our goal through community collaboration was to provide effective community supervision to those individuals while providing integrative substance abuse and mental health treatment services and providing them a safe place to be during the day. I really found a lot of passion in that work to address the social determinants of health, to truly get to the underlying needs of those individuals, to intervene in really creative ways. At that time, the criminal justice system was starting to shift. There was more emphasis being put on behavioral health treatment in criminal justice across the board, especially in the alternatives. The community correction system in the state of Colorado started developing residential substance abuse programs specifically designed to address substance use disorders, as well as addressing criminogenic needs. So kind of a dual diagnosis approach, not in the traditional sense of mental health and substance use, but criminality and substance use. I looked around the organization and realized that there wasn't a behavioral health provider on the leadership team. And that's where the conversations really started in regards to my role and how I got to where I'm at today. As the system continued to change and look at those things, I continued those conversations and saw the future of criminal justice in the state of Colorado really from an interventionist perspective, and really started to communicate and to push to have that perspective truly integrated into the organization as a whole. And hence, the organization developed a clinical director, and I have been in this role for the past 12 years. It is something that I truly enjoy. I started out my career working with clients and their families, and then shifted to really who my clients were different. It was no longer the individual and their families, but it really became the community and the staff. Developing healthy treatment milieus, developing healthy cultures within organizations, and ultimately providing programming for our communities that would create lasting change, that has been the passion of my career, is to create systems of care that were healthy, that hopefully will long last me in my career, and continue to grow and develop just as individuals and families do. How other people might find their way to a clinical director role such as mine, I think that it can be unique and diverse, but I think it always starts with being a clinician first. I truly believe that in order to do what I do, you first need to get what I refer to as your clinical chops. You got to be on the ground working with clients, understanding what it means from the client's perspective in doing this work, because that has to come first, before anything else. That we have to understand what our clients need, and we also have to understand what our system needs from our clients. So when we're able to understand what the system looks like from a client's perspective, and we're understanding what the clients are needing, then we can start taking that next step up of helping others, growing others, into becoming healthy clinicians at a supervisory level, and then taking that next step into what I'm doing, which is more program development, policy development, looking at broader issues, but it's all within that foundation of what does that human being need, that is in pain, that is struggling, and helping them get back on their feet. My responsibilities within the organization are really diverse. I sometimes am a direct care staff, in which I am providing group treatment to our populations. I will occasionally take on individual clients, but mostly my role is to manage our programs and develop our programs in a way that follow the evidence, of evidence-based practice, that follow the direction and the pathways given to us by the state legislature and by our contracts and regulatory agencies. I work with those folks in order to achieve that. I work with our staff in order to achieve that. I really see my job is to make sure that the supervisors and the clinicians have everything that they need to do the important work with the clients. So ultimately, I'm responsible for all of our behavioral health programs in criminal justice services. I also have some odd one-offs that aren't necessarily behavioral health, but definitely are in that realm of social services. I am responsible for our victim services unit as well. So we serve the victims of the offenders in our care and custody. I also am our PREA manager, so I oversee our system that is designed to ensure that we have a healthy and safe environment for our clients, so that nobody is at risk of sexual harassment or sexual assault within our facilities. We take that very seriously. We have a zero tolerance policy and approach to that. And mostly, I spend a lot of time working with our communities in the criminal justice system to enhance our services in behavioral health across our communities. So we are constantly looking to innovate, to collaborate, to best achieve healthy behavioral health outcomes across our communities. Right now, a big effort is in play in looking at our competency system. So when human beings that are accused of crimes, our competency has been raised, whether they can aid in their defense, looking at ways to enhance that system, to shorten those stays, to best address those needs. We're looking at diversion opportunities in our community for those with mental health conditions. Really, the intersection between behavioral health and criminal justice is really the target of those conversations and those collaborations, both with traditional community-based behavioral health providers, law enforcement, so police, and sentencing options such as ourselves, including the criminal defense, including criminal prosecution, and the bench itself in the 8th Judicial District. So lots of intersection in my role with the community, really kind of a broad view. Sometimes I refer to it as the 10,000-foot view of the folks, of what the folks are doing on the ground, and how we can best support them and meet their needs in the community. The hardest part of my job is some of those intersections between the budget and what we're paid and what we really need to do, and how to create those healthy environments, kind of integrating the business aspects of this work into what do people need and how do I get people what they need. As the clinical director, a lot of my work is working with the community. So I mentioned a lot of them in the criminal justice system, the district attorney's office, the public defender's office, the criminal defense bar. Also work very closely with our local community mental health center, as well as other behavioral health organizations in our community, both from a substance abuse specific perspective as well as from integrated care. We work very closely with medication assisted treatment providers in our community to integrate services, and also with educational institutions in trying to develop partnerships to bring in interns. I believe that this is one of the best places in the world to practice as an intern. As I always say, our population has been, by the time they get to us, have been in and out of therapy multiple times, whether that is for as juveniles, whether that is as adults, whether that is for substance abuse or other behavioral health needs. And because of that, and because of the fact that our clients are survivors, it's a great place to practice. It's a great place to take risks. Because as long as our hearts are in the right place and we're striving to do the right thing for the right reason at the right time, and we're here to serve our clients, we're not going to make things worse, especially if we can be humble and own that an intervention didn't work, or that it wasn't as effective as we hoped. That teaches a lot. This work really is based in an ethical practice of do no harm and give it our best shot. And as long as our clients are knowing that we're coming from that place and coming from a place of integrity, really caring about their futures, we can see amazing things happen. My schedule in my work, I chuckle a little bit because you hear a lot about work-life balance. And at my role, to me, it's no longer about balance. It really is about seamless transitions. Because I work in a residential facility, essentially in a correctional facility, we are here 24 hours a day, 7 days a week. Now, that does not mean that I'm here that long. However, but I believe very, very strongly in seamless transitions between my lives, my worlds, as father, as husband, as brother, as friend, as supervisor, as therapist. And I need to be able to make seamless transitions in and out of those worlds and in and out of those roles as my life needs. I'm lucky enough that I'm able to do that, where if my kids have a dive meet, I can go to that dive meet and take care of what I need to take care of on the phone, or in email or through text, and then come back to the office. If I need to completely disconnect during those times, I can disconnect during those times and then work later in the evening, that evening. Or if I want to, I can take off early on a Friday to go be with my family and then come in on a Saturday. It really is about what is needed for me, as long as the client's needs are taken care of. I am on call. We have a rotation here at the facility where the administrators are on call. And really that's for after hours emergencies. Typically it's not getting called in, but it's managing things over the phone, answering questions, giving permissions, giving authorizations, those kinds of things. So I try to provide that for the supervisors as well. I think at the clinician level, that's a little bit more difficult because it's the regulated work of how many group hours and how many individual hours and when things happen for the clients. So it's a little less flexible than myself or the supervisors, However, I believe very strongly in those seamless transitions and meeting those needs as best as we can. This is highly intense work. It's emotional work. We hear lots of trauma, and the experiences that our clients have on a day-to-day basis. As supervisors, we hear it from the clinicians hear it directly. As supervisors, we hear it from the clinicians and directly. As the clinical director, I hear it from everybody, as well as see it. It is really difficult. I think that the seamless transitions are really important. I think that clinical supervision is imperative. I think that clinical supervision is different than supervision than most people get, because it really is, in my perspective, a holistic view of that human being that I'm working with, and helping them grow and develop, helping them understand what it is that they're seeing and feeling, processing through those things as it relates to the work, getting them connected where they need to get connected to if it's impacting them outside of the work. Really trying to create a fun and a light environment in which we can speak honestly with each other in caring and compassionate ways. We do our best to take care of each other. We do our best to look for the signs and symptoms of burnout. Ultimately, we want people to have healthy lives. So we try to keep the workload as reasonable as we can within the business needs and what we're paid. Trying to balance those things out can be difficult at times, but we do our best.